Hello, my name is Ruqaiijah Yearby, and I am going to be speaking on October 13th in the Harvard Health Law and Policy Workshop. And today I am presenting a paper on health justice strategies and COVID-19. I am joined by my co-authors, Professor Seema Mohapatra at Indiana University McKinley School of Law, Lindsay Wiley, a professor at American University College of Law, and Professor Emily Benfer at Wake Forest University School of Law. And today we are going to talk about the ways that discrimination impacts and leads to inequities in COVID-19. Particularly structural discrimination, the ways that systems are structured that advantages the majority, disadvantages the minority, institutional discrimination, which is neutral policies that reinforce racial hierarchy, and individual discrimination that is prejudice and impacts access to healthcare, housing, education, employment, and social context. These all impact the social determinants of health, including poverty. And now Professor Benfer will talk about health justice.
So health justice is something we can use to actually address that discrimination and poverty. It is a key strategy for protecting and supporting marginalized populations, especially low-income communities and communities of color. And this is really true during the pandemic and in the recovery from the pandemic. Health justice is an emerging framework that eradicates unjust health disparities, especially that are caused by discrimination and poverty. And it calls for policymakers to provide access to basic health-related rights, protections, and supports that eliminate health disparities. And Professor Wiley is going to discuss the prongs to achieving health justice.
In our work, we identify at least 3 overarching principles to prevent and eliminate health disparities during and after the COVID-19 pandemic. First, we urge that legal and policy responses must address the social determinants of health, including structural determinants and root causes like structural racism, economic discrimination, and other forms of subordination as the causes of health disparities. Second, interventions mandating healthy behavior, so telling people to be responsible, telling people to adopt behavioral changes to protect themselves and others. Those behavioral mandates must be accompanied by supports and legal protections to enable compliance and minimize secondary harms. Finally, historically marginalized communities must be engaged as leaders in the development of any interventions and the attainment of health justice. With that, I'll hand it over to Professor Mohapatra, who's going to wrap things up with some examples of how this framework is applied in the COVID-19 pandemic.
Great. Low income and communities of color have faced barriers to quality healthcare for decades, and that has limited their access to healthcare facilities and good quality healthcare. So healthcare discrimination is itself a social determinant of health that influences health, and we address this in the paper. For example, healthcare institutions have closed hospitals in low-income communities and communities of color to relocate to more well-off communities. And this is an example of institutional discrimination. And people of color also face interpersonal discrimination in the healthcare space. Access to healthcare is a necessary and important component of health justice. And we suggest a variety of legal and policy measures and supports to achieve access to healthcare, including robust insurance coverage, and we advocate for leadership from within the communities involved, such as Black, Latino, Native communities, and other marginalized communities to drive these efforts to increase access.
So we hope that you will read our article that will be in the Yale Journal for Health Policy, Law, and Ethics. It is entitled Health Justice Strategies to Combat the Pandemic, Eliminating Discrimination, Poverty, and Health Disparities During and After COVID-19. Thank you.